All right. This first question is, what is a typical day for you?
Meaning what?
Like a routine kind of thing.
Okay. I get here usually about a half hour before my patients and I start getting the charts prepared,
Okay.
pulling the charts of the patients for that day, looking through them to see what I need to do with the patients to prepare my day and kind of plan it so that I'm not making anybody wait. I like to keep the time management pretty good, so um, I go through that, I pull the charts out, and then as the patients show up, I just start. And you see how I tend to do that. I go talk to them first, see how they're feeling, and then plan their treatment accordingly as to how they're feeling that day.
Okay. Have you ever thought of opening your own place?
No. I like treating the patients. I don't want to have to do all of the administration work. I wouldn't mind being, having a little more leadership role, but having my own entire place and having to do all of the day to day stuff with it, I would miss treating the patients.
All right. Next question is, how is your relationship with your patients?
How would you describe it? You saw.
No, I think they're great.
We try to have fun. We try
Yeah.
to make it so that they don't mind coming in. It's not like they're happy to be here because they're usually in pain. That's why they're here. So we try to make it as much of a family kind of fun atmosphere so that they, at the very least, they may not like having to be here, but they don't mind showing up because they like to see us.
Right.
We tend to have a lot of patients that'll come visit us even after years after, and some of my patients from the old place I worked still remember me when I stop in there. So,
Okay.
we try to keep it a good relationship.
Okay. Next question is, what would you tell someone who's going into this field?
Be sure that you've shadowed enough to make sure it's something you want to do. It's not something that you want to put the time in. It's very time consuming if it's not something you're going to want to do for the rest of your life. I find it very rewarding, but you need to make sure that you can do the day to day stuff. Sometimes you're doing things you're not great with. You get feet, you get all different body parts. You got to be okay with it. You have to be okay with seeing patients who are in pain and being able to talk them through it, like the patient we saw today. So, you have to really be able to work on the fly, essentially, because I might have had a different plan for him today, but we had to completely change it because of how he was feeling.
Okay.
So.
What do you or yes? What classes benefited you the most in college?
The ones that surprised me the most that I got benefit from were physics classes because I didn't realize how much physics was going to be important. But you need to know how things move and how the reactions are for it. So anatomy for sure,
yeah,
obviously, but that's a more obvious one.
Mhm.
Like I said, for more of a surprise for me, it was physics was very helpful. Chemistry classes were also a little helpful with some of it, especially with medication type things or reactions to things. But all of my anatomy, kinesiology, physiology classes so that you know how the body moves and how the reactions are very important. And exercise, but that's where the physics comes in.
Right. Next question. What do you find most difficult about your job?
Having to deal with people in pain who sometimes it seems like they may not want to get better, and then you're kind of struggling against them. You're trying to do the best you can for them, but you're not feeling like they're on board with you and trying to get better too. Other times you're dealing with people in pain who might seem crabby, and you just have to remember that it's not you; they're just frustrated.
Right.
So.
Okay. Next question is, what kind of training do you have for your job? What kind of training do you do for your job?
Meaning.
Like shadowing or stuff like that, or.
For school.
Yeah.
With school, what I did is before I got into school, I was a tech. So that I was working in the field to be sure it's something I wanted to do. Then I got accepted into the program. With the program, I mean, it's very regimented. You can look up all the, necessary things for it. But we did clinicals where you're pretty much treating the patients as a student. It's like a student teacher type thing with some supervision. And then you're out in the real world and you got to do continuing ed courses to stay up on things. But
Oh, okay. How is your relationship with other physical therapists?
We try to keep it. We tend to have fun. We have more of a family atmosphere. Both places I've ever worked. So, you're with these people more than you're with your family. You know them more than you see your family. So, I think it's pretty good. We have a good group here, and it's a lot of fun to come to work.
Number 9 is, what do you think is one of the greatest skills traits for this job?
Well, there's probably two. One is you have to have really good hands. You need to know what you're feeling. And two is you almost need to be a like psychologist with the patients. You need to know how to talk to them. You need to know how to calm them down if they're in a lot of pain. You need to know how to, talk them through situations.
Okay. Number 10 is, why did you want to become a physical therapist?
I always wanted to do something in the medical field, and I liked teaching, and you kind of get the best of both of that here. You saw how we have to teach patients certain things to do at home and things like that. So it kind of combined everything I liked. Plus, I had physical therapy myself before,
Mm-hmm.
and I liked what they did and the rewarding aspects of it.
Okay. Number 11 is, have you ever had an awkward moment with a patient?
Oh, yeah, always. That'll happen now and again. Sometimes it's with patients acting inappropriately, and you just have to, you know, remove yourself from that situation and let them know that that's inappropriate and tell your supervisor and have your supervisor back you up. But most of the time, it's pretty good.
Okay. And next one is, what are you doing for your free time?
For free time,
Yeah.
when I'm not here, I like to go away up to my cottage and be on the water. Just kind of rejuvenates me, I'd say.
Relax.
Yeah, definitely relax. Not have to talk too much because we talk so much here.
All right. Number 13 is, have you ever regret picking this job?
Nope.
Nope. Simple.
Only my second year of PT school, I think I regretted it. That was it. That was just because we get stressed out.
Yeah. All right, we got two more questions. Number 14 is, how long have you been doing your job for?
Since May of 2004. As a therapist. I was a tech for a few years prior to that.
Okay, and the last question is, why did you choose this job?
Thought we answered that one already.
Did we?
Yep.
Okay. Think I'm on the spot.
Good luck.
Would you, since you're a did you do any sports when you were younger?
Yep, I ran track and cross country. I played, that was more formally with school. I played volleyball, basketball, played football with my family. So lots of different sports, which I think helps with treating patients here.
Okay. All right. Thank you very much, Susan.
You're welcome.